Success.
I don't know how long that setup was.
Doesn't matter.
Must have been. But I got to time myself with these things. Maybe 15 minutes.
Yeah.
Not terrible. Okay. All right. Okay, ladies and gentlemen, we are back again. I'm here with Ludine Pierre.
Yes.
Okay. All right. So I usually let people introduce themselves, tell the audience a little bit about themselves. By the way, this is the No Supervision podcast. I probably should have started off with that.
Let them know.
Yeah, you guys know I'm out of practice with all this. So, but anyway, Ludine Pierre, tell us a little bit about yourself, and then we'll get into the podcast.
Yeah. These questions are so fun because I never know when to start, or what to say. But I'll just start with what I do. So I'm a licensed therapist in the state of California and Tennessee. I'm also a clinical supervisor at Spaces Therapy, which is a private practice, group practice that I'm a part of. What else do you want to know?
Well, okay. Well, I'll prompt you for why you're here. So when I first met you, we were in that big group.
Yes.
No, actually, I think we had met before that. We met before that. I think at that big.
Oh, yes. When you came to Spaces for the brunch.
Yes.
Yeah.
So we met a couple times, and I knew what people had done before, but I don't remember you mentioning the disordered eating aspect of that. So I got really excited when you mentioned that. I don't know if you remember, but I was excited. Okay. The reason why is I'd done a rotation when I was in Baltimore. They have a really big hospital there. And the disordered eating was a completely separate thing that they were treating. They had an inpatient, a step down, and they had outpatient services too. But I was at the step down, the PHP. And I really liked the rotation. I mean, it was a very enjoyable experience, and mostly because of all the people that worked. It was like a collaborative thing. So that was a lot of fun. And I've always remembered that. So when I started this podcast, one of the first topics I wanted to do was disordered eating. And when you first start a podcast, no one wants to talk to you. If your Instagram following isn't big enough.
I hear that.
Yeah, no one wants to talk to you.
It's the currency of the times.
Yeah. So I didn't give up, but I always had plans to come back around to it. So you mentioned you did disordered eating.
Yeah.
I was excited.
Good. I'm glad.
Yeah. Thank you for coming.
Of course. Thanks for asking me. I'm actually really looking forward to it because I know it's not something that really gets a lot of attention. Like you have to be in the niche in the world to really know about it. So I'm excited to be able to share with your viewers just a little bit about it.
It is niche.
Yeah.
Isn't it? Even so, again, one of my first podcasts, I think I was talking to someone who worked with people that had been sex trafficked, right? And I think at the time I was using the term prostitution. She was like, no, we don't say that anymore.
Yeah.
Sex worker.
Yes, sex worker.
Right.
New terms.
So if you notice, when I mention eating disorders, I say disordered eating now, but you kind of have to be around people or in the field to kind of know or maybe, really into social media to know that's kind of just not how we refer to it. Like it's only a few set of people that know that kind of stuff and maybe the younger generation as well. My generation, I don't know if we know that things have kind of changed the way we approach.
I mean, I hear you. I'm in that camp,
Yeah.
And I think things are ever evolving and changing, but I think the sentiment is still there. We're just trying to find better language, and you'll find that even, as we talk a little bit more about that, the word even disorder, I think, just hasn't aged well in terms of describing a response essentially to your circumstances, trauma, all of that. So yeah, I get it. But language can be helpful. It's everything.
There's lots of language with this niche.
Yeah.
Lots of it. I learned it back when I was Baltimore. Okay. So we know a little bit about you. We know why you're here. We're talking about disordered eating today. So that's fantastic. I covered the basics of hosting a podcast. What prompted your interest in working with this patient population? That's what I want to know.
Yeah. So it's actually really interesting because I had no intent because I didn't really know much about it in my career in school, right? So it was something that was presented to me as an option for my practicum site in grad school. And I remember walking through those doors and actually, let me back up. I think I was looking for work in grad school. The practicum came later, but I was looking for work and I wanted to work in the mental health field. And somebody was like, hey, I think you'd be a good fit for this unit. It's an eating disorder unit. at a rehabilitation center, essentially, inpatient. So I was like, yeah, that sounds interesting. And the minute I started working there as a mental health technician, so I'm actually glad that I started in that position, because it helped me know all the ins and outs of helping and treating and supporting people suffering with disordered eating. That by the time I was a licensed therapist, like I had done it all, right?
Okay.
So anyway, so what really piqued my interest was being able to see that it's not about vanity. I think that was the biggest thing. Here I am working with these individuals and learning more about what is at the root of these behaviors, and it all came down to relationship. And at the time, that's what I was really interested in unpacking, not only personally but professionally, is like what makes relationships thrive, what makes them, what brings up conflict, why can't we maintain like loving relationships, whether it's like parent-child relationships or romantic relationships. And so I started to see another world open up, essentially, because the eating disorder was a smoke screen for severed attachment, essentially, for many people. Right. So that's the long and short of it. That's what kind of piqued my interest. And then it was all downhill from there in a good way. And, I was able to see a lot of overlapping, what's the word I'm looking for? Yeah, just like overlaps with relationships, attachment, relationship to food, all of that. And then also substance abuse as well.
Oh, so when you said relationships, you didn't just mean with people, you meant with obviously with food.
Yeah.
No, I was thinking with food, but you're talking about relationships with people.
Yes. Yeah. So the food, and we'll get into that later, but like the food is a smokescreen, essentially. It's about the relationship to yourself and relationship to others.
And that's why we need someone to go deeper into understanding the psyche of that person.
Yeah, I guess.
All right, so let's we'll set the stage in this way. So we're talking about disordered eating. I eat food, you eat food. I don't know if you ate breakfast. We talked about coffee.
Yeah, I can't drink coffee. I would like to, but
what do you mean you can't? You don't?
Well, it's
doesn't
not
taste good.
Well, I it's an acquired taste, but I mean, it doesn't really have positive benefits for me.
That's right. Makes you sleepy. Yes.
Yeah. I wish I could. I love the smell. I love how it smells when people are walking around with coffee. I'm like, oh, that's sounds so delightful, but I can't be a part of the club.
So we just had, we just went on a conversation about, well, it's a liquid, of course, not necessarily food, but why would that not be considered disordered? Like what makes something disordered eating or drinking or whatever it is? Because I think in terms of definition, it's kind of difficult for some people to say, what classifies as something that someone needs to see a professional for versus just a normal habit that someone has.
So just to back up and make sure I'm tracking with you. So when you're talking about disordered eating, you mean like maybe just having coffee for breakfast, essentially, and just like moving on with your day?
Anything. If someone were trying to understand and I'll just use the regular eating disorder, all right? What makes an eating disorder versus somebody that just, I don't know, is very particular about the types of food that they eat?
Yeah. Well, eating disorder, right? There's like a continuum. And so what we're looking for is how much is this impacting your emotional well-being, right? Your physical well-being. And disordered eating is, honestly, if you live in a Western society, there's some level of disordered eating that you've engaged in at some point.
Probably.
Right.
Yeah.
But again, thinking about that continuum, like where does the pendulum swing? Like how far does it swing on either side? I think is more of how we gauge, right? Similar to substance use, right? Some people can consume alcohol and it's not disrupting their day-to-day, There's also functioning alcoholics, which is a whole other conversation. But ultimately, when we're talking about extremes, disordered eating is how is this impacting your physical health and your emotional health, right? And it can be pretty severe. But again, there's a continuum. Sometimes there's mild impact, and sometimes there's extreme, severe impact.
Yeah, there's lots of variance in between people. So, there's 3 categories that I can think of just from my training that I would manage if I were treating someone: anorexia, bulimia nervosa, and then binge eating. What would classify somebody as meeting criteria for that diagnosis is what I'm asking.
Yeah. So I think the easiest way to remember it, I think of like anorexia is, you are not wanting to consume food. There's a preoccupation with how many calories you're intaking. There's a focus on weight loss, right? And really body modification in terms of like changing your body, making yourself as small as possible. And I think so I won't get into that right now, but so anorexia is more so of like restricting, right? You're restricting food intake, caloric intake. You're getting to some pretty dangerous levels in terms of like even your, there are some signs, right? Like, so sometimes there's like a thin layer of hair that will start to grow because you've just lost so much weight. That's your body's natural response to try and protect and keep you warm is like, it's a very fine hair. It's like hair that grows on babies, actually. It's like very, very soft hair that you'll see on especially adults who have been restricting for a long time, right? Binge eating disorder is more of, I think of it as like, you don't know when to stop. There's something in your process that you're gravitating towards food for whatever reason, and it's just a constant. You might go off in secret and like isolate, and I think isolation kind of falls in all of these categories that we're talking about, but essentially it becomes very much like a secret process, right? Of consuming food quickly, all at once, maybe even overeating at times, or ping-ponging back and forth with like restricting at times and then binging at night.
So sometimes people have both. It's not one or the other.
Right, right. And that can show up. And then with bulimia, right, this is like purging, right? So you're getting rid of the food. You might eat, we might be sitting at this table and it looks like you're eating normally. Maybe you play around with your food, but then you're going out and getting rid of the food as soon as possible. Bulimia also looks like using laxatives, right? Anything that would allow you to release your nutrients would be under that umbrella.
So again, you can have all three of those, not just one. You don't have to fall into just one category.
Right. I think what I've seen more is like people who have started with anorexia, maybe in early childhood, restricting, being more, and then maybe they get a little bit older and then they might have a different relationship with food. And next thing you know, they're restricting still, but then they are having to binge for whatever reason. So I think it just varies person to person.
Is childhood a time at which a lot of these conditions start?
It can be. It certainly can be. I would say the majority of them will start in early childhood because it's a response to something in your environment, particularly in the family system, that's been disrupted, right? Or a response to trauma, be it emotional, relational trauma, physical trauma, So I would say most cases start there because when we think about attachment, right, that has to do with like your relationships with your caregivers, right? And that shapes how you end up coping with various negative circumstances that you might be facing. For some people, it's shopping. For some people, it's, drugs and alcohol. And then others, it's food, right? So there's also an emotional component for some people when it comes to how they treat food. And I like to talk to my clients and others about how it's a metaphor for nurturing, right? So sometimes we relate to food similarly to what nurturing we received or didn't receive, or what we had hoped to receive.
Right.
Yeah.
Right. So, I mean, I think the thing about a lot of those patients that I had worked with when I was in Baltimore, one thing that always stood out for all of them, they always had a story where they remembered someone said something about their body. That one time someone said something about their body and that just kind of set them off.
It depends person to person, right? However, I do see that that's a common theme. And I think it's in relation to kind of this society that is used to yo-yo dieting and everyone being kind of like weight conscious and body conscious. I think that's just like that's part of the Western culture, I would say, right? And so when you're thinking about developmentally for a child, things that people tell you, right? When you think about your mental capacity and their frontal lobe, right? You're not able to see the gray. So you're going to take everything at face value. So if you have a Nana who was just lovingly, maybe they didn't maliciously mean it, but they're like, oh, you're eating a lot for Thanksgiving, right? A kid at that point is going to take that as like, oh, I need to categorize this as good or bad, right? Mm-hmm. Something about that needs to be placed somewhere. That's our brain's natural way of understanding how to keep us safe is categorizing things as good or bad. That's why we have judgment, right? So if you have a kid who feels judged in that moment, it's natural for them to take that at face value and have an experience with that. Now, it doesn't mean that if you say something like that, everyone's going to have an eating disorder. So I want to make that clear, right? It's like there are different elements that kind of come together to create an environment where that starts to be a part of your experience with food.
You mentioned Western culture. Mm-hmm. Okay. I don't know a whole lot about Eastern culture. Like, what's the difference between Eastern culture and Western culture? What is it about Western culture? Yeah. And I don't know if you'd be able to contrast it against Eastern culture, but what is it about Western culture that could facilitate something like this?
Yeah, well, when I'm talking about Western culture, primarily I'm just talking about what we have here in the States, right? In America, the United States. Our relationship to food and body, I think historically has been about performance, right? You know, it's about optimal, like how you look, how are you received, perceived. That's not to say it doesn't show up in other cultures, but I don't think the emphasis is there as much because there are other things at play, right? Other places where you're putting your energy, right? And I do think that we could kind of go down a rabbit hole, so I'm going to try and not do that.
You have time if you'd like.
Because I have a lot of thoughts. But the long and short of it is there's a lot of yo-yo dieting. Okay, we're talking, if we really want to go there, you know, I would say that there are systems in place to sell a life, right? Like, in order for you to be happy, these are the things that you need. Your body needs to look like this. Your bank account needs to look like this. You know, your friendships or your community needs to look like this. And there's not much for the room for the individual, right? We're trying and have been, not saying that it's everyone's pursuit, but I do think it's a big part of the culture is to fit into a formula or to plug yourself into this formula and get this desired, whatever. You could call it the American dream. You can call it whatever you want, but essentially how to live, right? How to be successful. And I do think that bleeds into our relationship with food because now we have a blueprint, so to speak, that some people try to fit in. I think the current generation now, I think they're doing a great job of combating that in some ways.
Oh, yeah, they're not into it.
They're not into it. But my generation, you know, like growing up and seeing magazines that were, I mean, even thinking about topics, right? How to lose 10 pounds and get the prom date that you want. Like, what? You know, this is what was being sold to teens, right? So I do think that historically, and I'm going to get to the point here, I think the underlying issue is the pursuit of perfection, right? Mm-hmm. And so when we talk about food, we talk about body. Perfection is a direct attack on our humanity. It's saying that I can't have these lumps and bumps. I can't evolve. I can't change. I can't have these wrinkles. I can't experience the transitions that my body will naturally have that I think is different than in other cultures where it's like expected that at any given time, you might put on some weight and lose some weight because that's just the season that you're in. But I think we've made it kind of like an offense in this society.
You mean the fact that no one in this country wants to get old?
Or like...
Whereas other countries getting old is like, it's a great thing and they respect older people.
Absolutely. It's like, you know, you've
Stuff
made
like
it. Yeah. It's like, oh man, we want to listen to our elders. We want to, you know, treat that as sacred. And I think we are constantly chasing youth here, which again... nothing wrong with it unless you start seeing it as a direct attack on your self-worth, right? And I think when we're talking about eating disorders, disordered eating, and that spectrum of relating to food, I think we've learned to make food, and I say we, generally speaking, I know this doesn't apply to everyone, but I think most people see food as the bad guy when food is fuel. Right? And so, I think... hopefully, I think it's moving, you know, the needle is moving, but hopefully we can challenge some of those ideas of perfectionism just as a culture and embrace more of our humanity and change, right?
Yeah.
Which I realize is difficult because when you're talking about change, like that's the thing that your brain doesn't want. It likes routine. It likes to know what's happening next. It likes to know, like, what are we doing? But that's a survival response, when we can kind of ease up and acknowledge, okay, change is inevitable. Like my body is apt to change in my lifetime, right? I think it releases the pressure of trying to change our outward appearance. And I also want to point out that eating disorders are not only about the outward appearance. Again, like that's the smoke screen. The deeper issue is your relationship to self and others. Because when you go back to that example of the kid at Thanksgiving who's maybe having a second helping of a sweet potato pie and Nana's saying something about it, right? What's that relationship there? Right? Mm-hmm. And are we having real conversations where there's less criticism around our individuality? It's okay if you go for that second helping of pie, right? Let's talk about why you're doing it. Is it because you enjoy it? Or is it because you're doing it to self-soothe? Right?
All right. So let's say someone's listening to this and they have some of these symptoms. Yeah. Restricting, forcing themselves to vomit, binge eating, whatever it may be. How do they get help for it? Like, where do people go?
Yeah.
If they need help?
Where do people go for help? I think what might be happening is that when we're thinking about our relationship with food and how to go about getting help, it starts first with reaching out to one, there's a national eating disorder.org website, which I think is super helpful. So the NEDA website, you can go to your primary care physician, and although they might not understand about eating disorders, but you can say, hey, this is a concern of mine. Do you have any referrals or do you know of anyone? But I think first things first, like let's get you into therapy, right? It's important though to find someone, if you know that you're struggling with food, it's important to find therapists who have a background and understand, because it is niche and it's not something that you could go to any therapist, just like you wouldn't go to a podiatrist for, heart problems, right? It's very specific. Mm-hmm. So take time to look that up. And you can, like I said, the National Eating Disorder.org website has directories, right? And you can Google that too, like therapists or psychiatrists who treat disordered eating. And I would start there. Yeah. But in terms of like the inpatient setting, if you're at that place, generally people will, if you're, let's say, severely compromised health-wise, I think your best bet is to go to the hospital, and then from there, they'll set you up with being assessed appropriately. So for people who are like, man, I'm really concerned about this person, like it's just not looking good, you need to go get checked out by your physician.
Yeah.
Yeah.
When I was in Baltimore, I was working with kids at the time. That's where I did fellowship, right, at University of Maryland. And this leads into my next question. A lot of times kids don't know to ask for help. I think they're probably better now than they were in my generation or your generation. But a lot of times kids or even adults don't know how to ask for help. Someone usually notices that this is a problem. Mm-hmm. Is there a way that you would recommend someone talk to someone about actually seeking out help, or how they would get help for someone that doesn't necessarily want it? Because you and I both know some people like what they're, when I say like, that you know what I mean? Like they're entrenched in their behaviors and restricting, and they think it's good for them. Mm-hmm. And it's kind of hard to break through that lack of insight as to how detrimental it is for their health.
Yeah.
So are there ways that someone could talk to someone else about their concern about their eating?
Absolutely. So when we're talking about, I'm going to focus more so on like family relationships or, romantic relationships. Again, it's not about the food. I know that that's what's glaring and that's what you're seeing. Maybe the body is changing. Maybe they have some different eating habits that are concerning. Those are just it's like language, right? In some ways it can be a cry for help for some people, right? But this is language and behaviors that they've developed to try and navigate and manage something. So if you're really wanting to help someone, part of that is like, let's figure out who is the human in the room. Like, what is it that they're going through, and get them help for that, right? Because the eating disordered behavior is in response to something else, right? So maybe that looks like a parent who notices that they have a child who is restricting their meals, right? The way to navigate that is to say something like, I noticed that you've been having a hard time at meals. Can you tell me a little bit about how you've been feeling lately? The feeling will give us some insight. If you're feeling anxious, let's go down that rabbit hole together. What are you feeling anxious about? Well, this is what's going on at school. Okay, so when we think about it, it's possible that you're learning how to self-soothe that anxiety, right? Because you don't have your toolbox yet with your relationship with food, because it falls under the category of being kind of like a process addiction, right? The process is what helps you feel okay temporarily.
So they're addicted to the process
of
restricting or
Because most people that I speak to, even when they're in they're in it, right? Like this is their thing, they will tell you that they're miserable. They know that they're miserable, right? But it's the process is what allows them to feel contained. So we need to figure out, if you're a parent or a spouse or, a partner or a friend, like what is it that you're trying to work through? What's the stressor? And then when you get more information, that's when you can say, okay, would you be willing to go get help for that? Right? If you're feeling anxious, maybe we can get you some help for how to manage anxiety
in a positive way versus trying to control the way you. Because what I mentioned earlier was they think that it's helping them, the eating disorder.
But it is.
Well, it's helping them in a detrimental way.
Right.
Yeah.
But it didn't start out that way.
Right.
Right. So that's another thing that I like to share with folks is, I'm not here to villainize our maladaptive behaviors, right? The disorders. It's language that you developed. It's behaviors that you developed to help you do something. In some ways, that's being resilient, right? Because the person who's experienced physical abuse, who then has an eating disorder, right, is learning how to tolerate that pain and maybe doesn't have the tools or the language to do otherwise. And they've developed this process with their food that allows them to get back to their baseline, right?
Got it.
The only thing is it's not sustainable.
So that's the way they've learned to cope.
Yeah.
The coping is not, you think it's helping you. Maybe it is helping in a certain way where you feel like you're being relieved, but ultimately you're not. So when you're talking to somebody that you think has a bad relationship with food, you want to talk to them about trying to find a coping skill outside of what they've been doing.
And understand it.
Yeah.
Like, why did it show up? Why this? What do you get out of it? What's the payoff? And that will give us some insight of like, okay, what can we use instead? This was your security blanket for a while. Thank you so much. You saved me. And now you're being detrimental. So how can we kind of look for alternative ways to navigate what's at the root, which is emotional pain?
Right. Yeah. So, I mean, that kind of leads into my next question, which is when you encounter somebody that has disordered eating, how often are you finding those folks are suffering from depression or anxiety or, like, we know the answer to this, trauma? How often, in its many forms, how often, or how likely are you to, in someone that has disordered eating, to find someone that is suffering from one of those three or some other condition that is just under the surface?
I would say generally all.
Yeah. I was going to say 90.
Yeah. We'll give 90. We'll give 90.
No, 99.9, I think.
Okay. Yeah, that's fine.
I'm comfortable with that.
Yeah. Again, it's treating something, right? Same thing that we would say with someone who might have a dependence on a substance, right? What is it that you're treating? Like alcohol is a downer, right? So yeah, you're going to feel depressed, right? It's going to play off of each other. Nicotine smoking is like an upper. So some people smoke and drink at the same time because what you're doing is you're essentially regulating your emotions with substances. It's the same with restricting, binging, and purging. It's going to incite different parts of the brain and it's going to be regulating your emotions. It's a maladaptive way, but it's doing that nonetheless, right? So, I would say most people who have eating disorders.
We've agreed on 99.9.
All right,
you
all
can't
right.
take it back now.
You're right. 99.9.
I'm pretty comfortable actually with saying that, because I think anytime I encountered someone when I was at that partial that step down, I was treating depression, I was treating anxiety. I don't know if a actual medication or that would actually target bulimia.
Right.
There's one that might help.
Yeah.
It, but
Yeah. Help. Yeah.
Yeah. But you're typically trying to treat something else.
Yeah.
And then with the therapy,
Yeah.
which is probably what you're talking about, the relationships with the family and themselves.
Yep.
It gets better.
I have seen 9 times out of 10. I know that's like very bold, but this has been my experience having worked for over a decade with eating disorders. 9 times out of 10, eating disorder behaviors start to clear up or loosen their grip when relationships are restored. People learn how to be assertive, not to be confused with confrontational. I just had a conversation with someone about that, like the difference between confrontation and assertiveness, right? So yeah, restoring relationships to self and others, being able to speak up, setting appropriate boundaries, right? You start to notice some of these behaviors fall away. The eating disorder behavior sometimes serves as a relationship. It's the thing that you can count on. It's the thing that's consistent, right? So when we think about the brain again, right? Brain is looking for that, for consistency. So if you grew up in a family where you didn't know how mom or dad was going to show up on any given day, for your little nervous system as a kid, that's really unsettling. But you know that ice cream's going to be there, right? And it's going to taste the same every time, right? So just a small example, and definitely not to say that that's everyone's experience, but I would say most people who work on these more internal issues when it comes to relating to yourself and others start to notice that grip loosen a bit.
How often is family or friends actually, you know what, maybe that's not a good question, because it depends on I know the answer would be, if I asked that question, it would be dependent on the person. But I guess, how would someone who is a family member or a loved one know that they're not actually enabling the behaviors? Because I saw that a lot as well. I saw someone that wanted to help and wanted to make the person feel better, but they might have actually been making it worse. Is that something you commonly see?
Yeah, definitely.
In what forms does it usually pop up? Like, who's doing this?
Who's doing this? We're not here to blame. No.
I know.
No, it's funny though. But who is doing this? I mean, anyone can be doing this, right? It's the mom who's like, okay, you don't want to eat this specific food group, then I won't buy it. Just to kind of alleviate the anxiety for everyone watching you struggle to eat carbs, right?
Yeah.
But it's like, that's not helpful.
Yeah.
Right?
Trying to help.
Yeah.
Trying to make the person more comfortable.
Yeah. And that's why this is a family issue. It's a family issue. Because when you're thinking about how you, folks are relating to dynamics within the family, right? If we're looking at it through the lens of systems, right? Somebody in the family is not well, but they're the canary in the coal mine of a larger issue. If there's a mom, and I'm saying this again, no shade to moms at all, right? This is like, this happens. That's like, I don't want to see my child experience suffering. So then I start to join in on their particular needs, which is the eating disorder, right? We're not holding your child accountable. We're not teaching them, you can do hard things. Let's talk about why eating the spaghetti is bringing up anxiety for you, right? I'm going to do it with you. Generally, though, what I've also seen is that it's something that can run in families as well. And so in the work that I've done, you know, again, there are different presentations, right? However, it is common that this is also a family issue where you see a family member who has it and then the offspring have it as well.
Well, I would imagine there's genetic components. I would imagine there's behavioral components, because you're learning how to cope from the adults in the house. And if they're coping that way, that's kind of how you learn how to do it as well.
Right.
Yeah.
Right.
Yeah. Okay. So gender differences. People, that's just how the Western culture, right? I mean, we fight against that mentally all the time. But there are some differences, at least statistically, in the way, and that might have to do with the Western culture, with the percentage of men versus the percentage of women that have or are suffering from disordered eating. In your clinical practice, in your experience, and in my experience, I'll talk about mine, and you tell me whether or not this is true. I typically see 90% this being a ladies issue, 10% this being a guy issue. But I suspect I'm seeing the ladies because the ladies get help for it. Guys do not typically seek. Okay, you're shaking your head.
Yeah.
You're in agreement.
Yeah,
Okay,
I love talking about this.
Yes. So please, I'm going to give you the floor on it. But that's my understanding of it. That there are more guys out there that have eating disorders than we know about. In the books, it says 90-10, somewhere around there. But it's more than that.
Definitely more than that.
Okay.
Definitely more than that.
Okay.
And here's the thing, right? Let's even talk about the types of people that come and seek help, like you were mentioning, right? Even outside of eating disorders, people that come in and seek out therapy, majority are female identifying, right? So with that doesn't mean that men don't experience mental health or emotional health issues.
We suffer from selection bias where we see only who comes into us for the most part. Yeah.
That, but I also want to talk about the culture, right? I think we're just, again, you and I, different generation, the younger generation coming up, everybody's talking about their feelings. You know, they know all the mental health buzzwords. There's more of an openness to seeking help regardless of your gender expression. Great. Love that. And I don't think the numbers currently reflect what's happening with men, because there are still men that haven't even cried in front of someone before. How would they even show up and be vulnerable about whatever discomfort they have with food? And also, it might look differently. It looks different, right? Maybe it's more about like having muscles and being obsessed with being a certain size or presenting in a certain way.
There it is.
Right? Yeah. And there's still a process there. And so for me, eating disorder it's not a woman thing.
Right.
And I want to be very clear about that. I want all the people to hear it's not a woman thing.
Right.
This is the numbers that we have and the research that we have is because I think most women have been more open to talking about things and to being vulnerable to a certain degree. And it's something that we see more readily because you're seeing weight fluctuate or you're seeing behaviors, whereas like guys, I feel like can kind of conceal that a bit more, right? You see a guy at the gym for 5 hours, everybody's like patting him on the back.
Yeah, good. Dude, look at that's the only place I typically see guys compliment each other's bodies is in the gym. That's the only place.
Yeah.
Dude, look at your pecs.
Right.
Oh.
Right. And let's think about it again, thinking about the society that we're in, right? I think historically, that's not really been an avenue or an environment that was set up for men to be able to explore their emotional expression, their experiences. So yeah, I think the more that we talk about it, my hope is, and the more that we normalize that this is a everyone thing, right? It can be, regardless of your gender expression. My hope is that more and more people will seek out help. But first, let's normalize just even being vulnerable, right? And I think, again, younger generations might be in a better spot, to explore that. But for other individuals or, especially thinking about culture within culture also impacts that as well. Hopefully we'll see more of that represented in the research. But I have definitely worked with men who are suffering with, dissatisfaction in their bodies. And then also recognizing just like comorbidity, right? Like sometimes you can have a substance abuse issue and you have issues with eating, or it's induced by various drugs, so like this stuff can develop in any way. It doesn't have to be necessarily like, oh, I'm trying to be thin and whatever. It's just again, an attack on your humanity.
Right.
It's trying to achieve perfection, but like the pendulum went all the way to one side.
Yeah, I think whether it be through physical debilitation or even mental debilitation, a lot of these patients are high risk conditions that we're talking about here. So being open to talking about it is going to be very important. Very, very important. Okay, let's transition just a little bit. Still talking about disordered eating, right? But Ozempic is in the news.
Yeah.
What are your thoughts? I'm not going to give you a question. I'm just going to say, what are your thoughts?
Yeah.
I just want to know. Because this affects the guys and the ladies, like equally, I think.
Yeah. Well, I know that Ozempic becoming more common as a tool to lose weight has been a relief for people who have been seeking that out. It is for diabetes, right? So obviously there's medication, and I know you know this, but medication that can be used for multiple functions. What I think about it though is it's a Band-Aid, right? And some people will argue that it's a starting point. You know, if this person has been preoccupied with losing weight, maybe if they lose weight, it'll free them up to do some of the deeper work, right? That is a possibility. I'm going to just,
open to
the possibility.
Yes.
I'm sleeping with one eye open though, because I do think that it kind of allows the person to fall again on a crutch rather than, and what I mean by that, not to sound harsh at all, but thinking about disordered eating behavior, again, you're managing something and not getting to the root, which is your emotional well-being, your relationship to self and to others. So Ozempic, again, just seems like a Band-Aid to a larger issue. And so my fear is that because it is a quick fix that gives you desired results quickly, right, that it can cloud maybe some of the more deeper work that could be, more accessible, right? Because at the end of the day, you could take Ozempic and still not be aligned, with yourself and with others, with your worldview. I mean, there's just so many factors there, but I really do think the antidote to any process issue is our healthy relationships. And I just don't see where, and I'm happy to be wrong, but I'm just saying in what I've seen and what I've witnessed continue in some of my clients who have, and the people that I've worked with who have maybe saw that as an opportunity to realize their quote unquote body goals, right? I think that it's taken away from some of the deeper work they could be doing to restore their healthy relationship with self and with others.
Well, it's like, I think of what you just described as sort of like hitting the lottery and still not being happy after you have all that money. There's still other parts of your life that you need to deal with first. And money didn't exactly solve it for a lot of those folks.
Yeah.
So even if you lose the weight, which might be something that person desired like all their life, there's still other things that they need to work on within themselves.
Yeah. I want to say something to that because I think that's so powerful. And going back to kind of thinking about residential treatment for eating disorders, I think that was one of the powerful things about being in a place like that and helping people was that people who had been excessively losing weight were able to share with their peers who were at a normal weight or, a healthier weight. Like, I've done it all and I'm still so unhappy. Right. So this was never about your body, and this was never about food. This was about something deeper. So until you're open and willing to meet yourself there and practice what we call radical acceptance, meaning you don't have to like or love your body, but you can accept that this is what you have, right? How do you make it work for you in a way that you're not harming yourself? And so for me, going back to Ozempic, I know that there are a lot of people who would disagree, and that's okay. I'm happy to have like conversations and look at it from all sides. But right now, I don't see the benefit in that because of what I've seen it do to people that I've worked with. Yeah.
You haven't said anything bad about Ozempic. It's basically just, listen, if you're going to do it, that's fine. But just make sure that everything else is taken care of or in the process of being taken care of. I don't think you have an issue with people losing weight. It's just doing it in a healthy way, physically and mentally.
And I think really just asking the larger questions, like why are we losing weight?
Why are you doing it?
What's behind it?
Is it to make yourself happy or someone else? Or,
yeah. Because again, I believe in health at every size. Mm-hmm. Okay, so again, these are questions that one needs to ask themselves, and with the help of a trained professional to really get to the root of like what's underlining this. And again, preoccupation with a process is what we're wanting to focus on here, is like how much of this is taking over your life, your brain space, your day-to-day, your relationships. You know, oftentimes people who are in this process are not seeing their family members as often, are not seeing their friends often. They're kind of like creating this their own little world of isolation, and they've shut themselves off of having real relationships because now this has taken precedent, right? So again, continuum.
Yeah, no, that's so interesting because you're right. There are people that achieve extremely, extremely thin like body frames after restricting long enough, but they're still doing it. And I think that kind of matches what you're talking about with it being addicted to the process. It's not even the outcome anymore. It's just you're just doing it just because that's what you're used to. Yeah. Mm-hmm. Okay. See, stuff full circle. Mm-hmm. One of my biggest questions, and one of the more complicated things. We just talked about addiction, right? Mm-hmm. If there's a substance that someone has an addiction to, opiates, coke, even marijuana, whatever it may be, one of my recommendations, a part of a number of different recommendations, would be to stay away from that environment that might prompt you, or stay away from friends that might encourage you to engage in using drugs. That addiction, whatever that addiction is, that's kind of hard to do with food. Mm-hmm. You can't exactly just say, hey, mm-hmm. stop what you're doing. You have to eat. Mm-hmm. How does one approach that situation when the very thing that's causing you the problem is something that you cannot avoid? Yeah.
Well, there is a privilege there where if you want to make that scarce in your life when it comes to substance dependence, right, that you can. Right. But I would even say, again, change your relationship with the substance if you can, because you might not always get to have that. Right. And with food, again, it's changing the relationship with food.
We're back again to this. See, I think like a psychiatrist. See, I see what you're saying.
Okay.
Go back to the same thing. Relationships.
We're going back to relationships. Yeah. And I failed to mention this earlier, but what I specialize in is helping people through relational trauma, mm-hmm. right? Eating disorders and working with neurodivergent people. So ADHD, things of that nature falls under that camp. But I'm a big proponent of relationships being at the crux of a lot of emotional pain. And trauma changes the brain. If you've got traumatic relationships, your response to that is going to continue to induce trauma. It's self-inflicting, right? So for someone who's like, well, I don't want to eat this food. I have a fear of this food, right? I'm wondering if there are other fears in your life, right? Because this is a microcosm. It's a mirror of how you're showing up in your life. So do we need to work on how you approach fear? How can we change your relationship with fear? This is not about the carbs necessarily. The carbs is just alerting our attention to how you navigate fear.
So if food is a trigger for you, you want to focus more so on why it's a trigger.
Right. It's not about the food. I can't say that enough.
I know.
I know.
It took an hour.
I feel the need to reiterate.
It took a whole hour for me.
No, you're good. No, but really and truly, yes, there is a fear there. No, I'm not going to tell you to avoid food. That defeats the purpose. Food is fuel. We all need it. Right. Your body knows what to do with food, but the relationship that you have with yourself might cause a mistrust in whether or not you'll be okay if you consume food. So that's what I want to work on, is where did this fear originate? What is driving this fear, right? Because, and most of the time when I do the deeper work with someone, we end up getting to a place where it has nothing to do with the food. It is a relationship, a perception, a judgment, something that needs to be explored further to empower the person so that they can have agency. They can flip that all around. They can change that experience. Yeah.
Took a whole hour for me to solidify that in my head.
It's all good. Ahead of time.
I love it.
Yeah. Yeah.
I don't have any other questions.
No worries. This was great.
Yeah.
I mean, I could talk for a long time, but
You got other stuff?
I do have a lot of stuff.
Yeah, I'm happy to hear it. So I've known that food wasn't I've always used the term control, like control issues.
Mm-hmm.
I think you talked about that some earlier in the show when you were talking about I think you were talking about a teenager who would, when they didn't have a great relationship with their parents, but they could always rely on the food. You know, for me, I'm hearing like a control thing. That's just kind of how I matched it. But again, if you go deeper or look at it from another perspective, relationships,
Yeah.
right?
Yeah. But control, I think, is a response to the severed attachment, right? It's insecure attachment. And once you can find some security somewhere, you develop a relationship with that.
Mm-hmm.
So in this case, for many people, it's either eating or not eating, restricting and binging. And then there's more too that I wanted to share a little bit about, because those are the three that we talk about. But they're excuse me, other specified feeding or eating disorders that don't necessarily like fall under a traditional category, but there are some elements of disruption, right, that are occurring. And it's not necessarily about losing weight, but it's like a preoccupation, right? And so you can't really cleanly define it in these three categories.
Let's have it.
And then there's avoidant or restrictive food intake disorder. I often actually find that to be in conjunction with people who have ADHD. Right? When you think about some of the presentations of that, difficulties with executive functioning, you know, experiencing task paralysis, like getting overwhelmed or flooded, your nervous system kind of like responding, reacting, or being so understimulated, you're just kind of stuck, right? That will get in the way of being able to feed yourself properly. You're not actively trying to lose weight, but I work with many people, you know, who might forget to eat all day, and that becomes a pattern.
You can't see me, folks, right now. Some of you are listening. I've raised my hand.
I mean,
might be for a different reason than the folks you work with, but I do that.
Well, what I'm saying is, right, it's like you can anyone can forget to eat.
Yeah.
What I'm saying is that becomes the norm, right? That informs just okay, where's your relationship at with food at this point, right? And what I find is, and this has been really interesting, is like recognizing how often eating disorder behavior, disordered eating pairs with neurodivergent presentation. That has been a recent fascination over the last, I would say, 5 or so years, just because in all my work, I was seeing these overlaps, but I wasn't really seeing it. And then I started to realize like, oh, there's like a lot of people who are dealing with ADHD and also have a very complicated relationship with food. That needs to be addressed and talked about. And I think it's more so coming to the forefront with some providers, but definitely not really talked about enough. And I think it's important that if you are treating someone who is neurodivergent, to also explore their relationship with food. And yes, they might not fall on that continuum of like extremes necessarily, but their relationship with food is also impacting their function. Because if you're not eating all day, your brain, your body starts to rely on your organs for sustenance. Like that's a real thing because you've kickstarted a starvation mode. Your body is going to go into fight or flight. It's like, whoa, we have not had any fuel today. What are we going to draw energy from, right? So the sluggish feeling, the fogginess in the frontal lobe, like all of that is in response to not being fueled appropriately.
You're saying folks that are neurodivergent sometimes suffer from this, not on purpose. It's just sometimes anxiety or
exactly.
Okay.
Exactly. Another thing too is anxiety, right? We feel anxiety in our stomach. So oftentimes we conflate or we're not able to access hunger cues and fullness cues because the anxiety sensation, right, is the thing that is most present, right? So you might skip a meal because you feel full because you're anxious. When you manage the anxiety, you notice that your hunger and fullness cues are more readily available and you're able to access them better.
That's
right?
why a lot of people that are suffering from anxiety or depression or appetite returns.
Yeah. Another thing that I don't think gets talked about is Pika, right?
Oh, yes, Pika, yes.
That is, again, it falls under that umbrella. Again, not maybe the most common that's treated, but it's out there, right? And Pika is when you're eating things that you wouldn't normally, that you're not supposed to be eating, like soap or sand, things of that nature. Where paper. There's like a fixation with like eating things that you're not able to digest properly and that are harmful. And then there's orthorexia. So this is like when people who are really focused on making sure that they're not eating certain things, like they'll eliminate dairy or they'll eliminate, and I know people are going to be like, well, yeah, veganism or yeah, great. But there's, again, a continuum when you're doing it so much so that it's consuming your life in a way that doesn't allow for flexibility, right? And can become a detriment to harmonious eating. Excessive exercise.
Oh, yeah.
We touched on that a little bit when we were talking about, men and whether or not they're a part of this conversation when it comes to relationship with food. But excessive exercise is something that, again, it's not about good or bad. It's not about don't do it or do it. It's about their relationship. Like, what purpose does this serve? And is it getting in the way of you living a harmonious life? Is it adding more value or is it taking away? And that just depends on where someone is on their journey, how they choose to respond to that. But I do see that excessive exercise is something that is common with disordered eating. And I think you and I touched on this on the first time that we met. We were talking about how sometimes people would find ways to keep their bodies moving.
Oh, yeah.
Right?
Trying to lose weight. Yeah. Keep the weight down.
Right. And I think there's something to be said of like not finding harmony. I try not to use the word balance because I don't think we can ever really find balance. Harmony is when things are working together for your benefit. And so when I think about exercise, body movement, all of that can be beneficial. Again, what's the purpose behind it? What's driving it? And is it allowing for you to be in harmony with other things in your life, your friendships, your work, your state of mind, right? I know sometimes people will say, well, 5 hours in the gym is just like my therapy. Great. What relationship did you develop in the gym for 5 hours? Like what did you get out of that? Right? Can there be some moderation? Can there be opportunity to move your body in different ways? And also normalizing that you not going to the gym, but maybe opting to go for a walk or a hike or a bike ride or surfing, that is still you communing with your body in a physical way and still getting the same benefits, right? So yeah.
No. When you say 5 hours in the gym, I'm ready to give somebody a high five. I like it. I have to, I can be a mental health professional, still be kind of detached from not my niche.
Yeah, we're all on our journeys.
Yeah. No, but these are these are important things to think about, and this kind of goes back to why I enjoyed my rotation back in Baltimore. That kind of changes the way you look at things.
Mm-hmm.
Again, somebody tells me they spend 3 hours, 5 hours in the gym on a normal. If I weren't talking to you right now or have my background, I might say high five. But now I start to think about, hey, maybe something else is going on here. Maybe there's not, but maybe there is. Just opens up your perspective.
Yeah. And I think it's really not about even being able to say, oh, this person might have this issue because of whatever. It's more so, again, of I've said this so many times.
Say it again.
The relationship, What is your relationship to the thing that you're doing, the thing that you're spending time with, the thing you're allowing to consume you? There are seasons for things too, right? Like if you're training for a marathon, then that's where your energy is going to be. And hopefully there are other things you can plug yourself into to get some type of fulfillment, even when you're not training and doing that. So
the best way to teach people something is repetition. So you're okay.
Thanks for that affirmation.
Anything else?
Let's see. No, I think we covered a lot, actually.
Nice.
Yeah. Do you have any additional questions? I know I didn't really get into the ins and outs of like physical signs and symptoms and emotional and behavioral signs and symptoms of eating disorders.
No, we can always. Sometimes I like to do an overview of things, and then we can go more in depth. I've had people come back as return guests to talk about certain topics. No. We wanted a general overview.
Yeah.
I wanted a general overview.
Yeah.
I just give it to people as I want it.
You're like, this is what I like. You're going to experience it too.
Power of not being paid for this.
Yeah.
Okay. So that was great. Okay. So I don't have any other questions for you. If people do want to get in contact with you, either seeking treatment or they have questions about the topic we discussed today, how would they get in contact with you?
Yeah, so you can find me at my website at lptherapy.co. And then I'm also, you can find me at Spaces Therapy LA. And I didn't add this, but I'm also a surf therapist. And so using the ocean for healing, as a modality for healing has been a big part of my recent work. And I find that helping people embody play and security and resiliency, with the ocean or by the ocean, because there's just a lot of benefits with the ocean, water, any body of water, honestly, that really helps us with our mental health and our emotional well-being. So, that's been a big part of my experience. So, stay tuned for that. We're going to be running some surf therapy groups and in the fall, and so I'm looking forward to that.
Nice.
Yeah.
Nice. Well, ladies and gentlemen, I don't have any other questions. I want to thank you for returning. I haven't posted a podcast episode in like 6 months. Thanks for coming back if you're here. We're all finished. Great job.
Thank you.